Welcome to Quinte 7 at Belleville General Hospital, Maternity and Pediatrics.
Welcome to Quinte 7. My name is Christine. When you arrive here, we'll take your information and we'll ask you to go to either our assessment room or the waiting room.
So this is our assessment unit where you'll come when you think you might be in labor. We'll put you on the monitor and just watch to see if you're having contractions. Also, if you're being induced, you'll come to this area and we'll start your induction as well. And the doctor will come and assess you in this area. From there, you will either be triaged home or to a labor room when you're in labor.
Hi, welcome to our labor and delivery birthing suite. This room here is where you would come when you are in active labor or when you require one-on-one nursing care. So to my left is where you would labor and deliver your baby, and to my right is where baby is brought after delivery to be warmed up and dried off. We count fingers and toes and make sure baby's doing well. And then you would stay in this room for about an hour and a half. Right here is where the dad or support people will be able to get some rest while you're in labor. And generally in this room, within the first half an hour to 1 hour, we like to start breastfeeding if that's your choice, and do some health teaching before we move you out. So once you're done in the labor and delivery room and you're all cleaned up, we move you out to the postpartum unit. While you're here, you could be in this room for generally 24 to 48 hours, depending on how you and baby are doing following a vaginal delivery. And if you have a cesarean delivery, you could be here for 3 to 4 days. This is our ward room, which has 3 beds in it, so it could be yourself and 2 other new moms in the room with you. We also have several semi-private rooms, which have 2 beds in them. And then we also have private rooms, and you are assigned those rooms depending on health benefits and activity on the unit.
We have 2 ORs in Quinte 7. Both of them are on the unit you will be laboring on. So if you happen to have a section, you will be coming to one of these rooms. Your support person could be in the room with you as long as you have a spinal and you're awake. Your baby also stays with you in this room for most of the time, and then we'll meet you in our recovery room, which is also on our own floor.
Hello, this is our special care nursery. Special care nursery meaning any baby that needs special care would come here instead of being out on the floor with mom. Babies that would come into the nursery perhaps need an isolette for warmth, or we do also administer oxygen while they're in an isolette. Other babies that might come here would be premature babies. They need help with their warmth and as well as their feedings before they can feed and grow and get well enough to go home. Other babies that might come here would perhaps need an intravenous and IV antibiotics. Feeding issues, sometimes they can't breastfeed or bottle feed and they need a tube, a nasogastric tube that goes in their nose and into their stomach so they don't have to do the work of feeding. And babies are in here sometimes for an extended period of time. Mummies sometimes are discharged home, so then baby becomes what's called a boarder, and they would be here sometimes for somewhere up to a month sometimes. Moms and dads are welcome to come anytime, day or night, and they come and they help with feeding and changing diapers, and we get them as involved in their care as possible so that they're able to feel like they're comfortable taking baby home. We also have a care by parent room over in the corner that has a room that mom can stay close to discharge with baby in the room so that she feels like she knows what it's like to have baby sleeping with her before she goes home. So sometimes they're not always in an isolette when they're in here, sometimes they're in a crib, and they're just here for monitoring for heart rate and respirations, and we have a monitor that shows the saturation of oxygen in their system so we can gauge their care with that. Other than that, when babies are well and healthy and able to do things on their own fairly well, if mom is still in hospital, then they would be transferred in a crib out to mom on the other baby unit.
Hi, my name's Carmen, and I work up here on maternity and pediatrics, and I'm an HSR, which is a hospitality service rep. And I clean the rooms, and I do supplies, and I'd be more than happy to help you.
Hello, my name is Andrea. I'm a registered nurse up here on pediatrics. Welcome to our pediatric department. We are located on Quinte 7 with the Maternal Child Program. We look after people from newborn up to 16 years of age, and we believe in family-centered care.
Hi, my name is Kathleen, and I'm the social worker for labor and delivery, pediatrics, and the special care nursery. My role is to provide emotional support, crisis and bereavement counseling for obstetrical and pediatric patients. I also assess and educate women about mental health issues such as postpartum depression. I liaise with the community service providers to advocate for our patients. I provide education, support, and training to staff and patients about psychosocial issues. And I coordinate alternative family planning situations such as surrogate births and adoptions. I also ensure families are provided with the education, support, and follow-up services necessary to promote healthy growth and development. The social work office is right here on Quinte 7, and I accept referrals from patients, physicians, and staff.
Hi, I'm Shelley Kay, and I'm the Program Manager for Quinte 7. My responsibility is the daily running of the unit. I welcome your comments and suggestions.
I'm Tracy. I'm the clinical educator for the Maternal Child Program, and my daily role is to ensure quality patient care for everyone. I welcome suggestions and comments as well.